All right, we're here today with MaryJo, and MaryJo is coming to see Dr. Davis for knee pain. So, MaryJo, tell me a little bit about what an average day is with that knee pain.
On a scale of 1 to 10, most days it's about a 3.
Okay. And is there something that makes it worse?
Standing, just standing in place.
Okay. That standing in one place would really,
Right.
and
So
then
if
you
I was
kind of
in-
have to go from foot to foot to
Right.
relieve some of the pain.
Right.
And how long have you been experiencing pain in that knee?
For about 7 years.
Okay. And it's just not getting any better. It's just,
Well, I had the knee replacement surgery in 13, and then I damaged it right after the knee replacement surgery.
oh, good grief. Good grief. All right. So, that the knee that you're having problems with is the one that you had surgery with?
Yes.
Okay. All right. So, and you said today your discomfort level was I forget.
2, 3. No,
Okay.
it's actually higher because I've driven quite a while and I've sat quite a lot today, maybe a 3, 4.
Okay. So when you're sitting, it seems to get a little
Yeah,
irritated
right.
there.
I mean, if I sit for a long period of time, it gets stiff.
Okay. All right. So how is it negatively impacting your life? What do you want to get? What is your goal to get back to start doing something?
I would love to get a bicycle and be able to ride a bicycle, which I love to do in my neighborhood. I would love to do in my neighborhood because it's a very good neighborhood to do that, but I can't do it right now because it won't bend that way.
All right. So we got to get your knee bending, get you back on that bicycle,
Yep.
and get you out there.
Yep.
All right. So I'm going to have you do a couple different exercises for me, and they're going to be very easy. I'm just going to have you stand up for me. Now, did you feel any discomfort in that knee when you went from sitting to standing?
Minimal, maybe a 2.
Okay, and where did you feel it at?
On the outside left.
On the outside left. Okay, I'm going to have you just put your feet shoulder length apart, both arms out in front, keeping your heels on the ground. I'm going to have you squat down as far as you can. And slowly come back up. Where did you feel that?
Both knees in the
Both,
front.
both knees in the front. Okay, all right. The next thing I'm going to do, MaryJo, is I'm going to have you go up and down the stairs for me. All right, now we're going to go right on back up. All right, MaryJo, how was that? Which was worse, going up or down the stairs?
Going up.
Going up the stairs, and where were you feeling the discomfort?
Both knees in the front.
Okay, like right below the kneecap there?
Yep.
Okay. So, out of all 4 exercises we just did, up and down the stairs, squatting, going from sitting to standing, which one bothered you the most?
Going up the stairs.
Up the stairs. All right, you ready to get started?
Yep.
All right.
All the way. Good. Traction again. Deep breath. And pull. All the way up. 2. Keep going. All the way, all the way, all the way, all the way. Good. Again, nice deep breath. And pull. 1, 2, 3. Pull, 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 pull. Good job.
That one hurt.
You right?
Yeah.
Take a deep breath and pull up. 1, 2, 3, 4, 5, 6, 7. Good. Traction, deep breath and pull. Keep going. Pull all the way up. Good. One more up top here. Deep breath and pull. 1, 2, 3, pull. 5, 6, 7. You got it. Pull through. Just gonna unlock that knee. That's good. Good job, MaryJo. 2 more there. Deep breath and pull. Pull through it. Good, 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 good. Okay.
You're filming me.
Deep breath. We're filming your knee. Deep. Keep pulling.
Oh, that
Pull,
hurts.
pull, 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 pull.
Oh.
Nice deep breath and pull. There you go. Pull through.
Oh, that hurts. That hurts. That hurts. That hurts. That hurts.
Does it hurt worse than your bad knee?
A little bit.
It does?
Yep.
Take a deep breath.
Mm-hmm.
Keep pulling.
Golly. Yeah. Oh. Oh. Oh.
Keep pulling. Keep pulling. You got it. You got it.
Oh.
You got it.
Yes.
One more. For all the marbles. Deep breath and pull. Keep going. You got it. 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 Okay.
Oh, me.
Pull up. Keep going. Good. Deep breath and pull. Keep going. Deep breath and pull. All the way up. Keep going. Good, good, good. Deep breath and pull. All the way up, all the way up. Good job, good job. Okay. Okay, take a deep breath and pull your knee up. Yep, that's good. Keep going. 3, 4, 5, 6, 7. Reach down. Good. Okay, deep breath. Pull that knee up without straightening it. Yep, good. 3, 4, pull up. 5, 6, 7. Reach down again. Okay, deep breath and pull up. 1, 2, 3, 4, 5, 6, 7. Down. Deep breath and pull up. 3, 4, 5, 6, 7. Down. Good. Good job.
You got a couple inches on that one.
I thought you were gonna do a
Take
dance.
pressure off your low back too,
You don't know who I am.
because you got your hamstring.
Just loosen up, MaryJo.
I'm trying. Give me a drink and I will.
Put your hand there.
Well,
Okay. Good. Okay. Take a deep breath. Pull your knee up. Yep, just your knee. There you go. 3, 4, 5, 6, 7. Reach down. Okay. Deep breath. Pull up. 1, 2, 3, 4, 5, 6, 7. Reach down. Okay. Deep breath and pull up. 1, 2, 3, 4, 5, 6, 7. Reach down. Okay, deep breath and looking differently, like your stride's going to be longer. You're just going to feel a little bit different. So we just go ahead. Yeah.
okay.
So just
Are you gonna film me? Huh?
Yes.
just try to walk normal.
Does it feel different? What feels different?
It's not tight.
Good.
Doesn't hurt. My back doesn't hurt.
And I've got you for 3 months to do any little tweaks that I need to do. So good job. You made a good decision.
All right, we're back with MaryJo, and MaryJo has finished her treatment with Dr. Davis. So let's see what you got. Can you stand up for me, MaryJo?
No.
What happened?
I don't know.
All right, you want to try it again?
Yeah.
Okay.
There we go.
There we go. Does that feel any different?
Yes. No
Okay.
pain.
Good, good. Now let's try to do that squat. So feet shoulder length apart, arms out in front. Look at you
Whoa.
go.
Oh, my balance is terrible right now. Though.
It's going to get much better. It is going to get much better. So let's try the squat one more time. That was easy peasy.
Yes.
All right, let's go up and down the stairs. There you are. All right, so MaryJo.